I want to do a quick video on validation. Let's talk about validation. I typically don't like to use my channel to complain about doctors because I feel as if it takes energy that they don't deserve. Um, and I just like to stay positive. A lot happens between hospitalization, changing medications, dealing with people. But this one specifically, I want to talk about. I was discharged from the hospital July 12th. Excuse me. By July 3rd, I started having a fever again. I was discharged with a PICC line, and I was given daptomycin. I had to take it for 6 weeks because I had a septic thrombus, just a blood clot. Well, not just a blood clot that was infected, and the way they treat it is with antibiotics. So anyway, I was having night sweats. I was weak. I was literally sleeping all day. I couldn't get up, and what else was happening? I had a fever. I didn't take my temperature. Uh, the site around my PICC line was red. My GJ2 was oozing pus again, and those are the same exact symptoms that sent me to the hospital. So I messaged my infectious disease doctor. I thought I messaged her. I was wrong. I didn't hear from anybody. I have severe abandonment issue, especially by physicians when I feel like they don't reply me. I feel like they don't want me anymore. I feel like I'm too much for them. So anyway, I didn't hear from anybody, and so to, I guess, protect myself, I didn't even check my messages. Monday comes and my arm is hurting. I mean, the pain is shooting up my arm and down my arm. Mind you, this whole time I was in the hospital, I've had peripheral IVs. They always blew. I've had midlines. I ended up with clots. So this pain and this picture of infection was bothering me. So I decided I'm going to pull out my PICC line. So I did. And this is the disclaimer. I'm not telling you to go and pull out your PICC line. I pulled out my PICC line because I felt clinically and according to my judgment and my expertise also as a healthcare provider, I knew what to do. So I pulled it out. I pulled that bad boy out. Literally within hours, I started feeling better. No more night sweats, no more fever, no more pain, no more redness, everything. Oh, and my GJ tube stopped losing pus. I had a feeling that it was infected. The day I left the hospital, I had the temperature of 99. Whenever I have a temperature of 99, for me personally, with my trends, that's a fever. I've always said my temperature lives between 96.3 and 97.3. When I start to hit the 98, 98.6, it's like, uh-oh for me. Anyway, so I took it up. I felt better. The issue was that I have to take antibiotics for 6 weeks. So I started a peripheral line. I was able to take my antibiotics. The next day, my line kept blowing and it kept blowing. I reached out to one of my doctors and asked him if he could please put in an order for PIV 3 times a week and to have nursing come and do it. He did. So that happened on a Monday. On a Tuesday, I believe I had my orders. On Friday of that week, I get a call from Infectious Disease. Who is it? The nurse for Infectious Disease. She said, we heard something happened to your PICC. I said, yeah, it came out. She's like, okay. I said, I removed it. I removed my PICC. I said, I sent a message. Nobody replied me. She said, no, you didn't. I said, yes, I did. She's like, no, you didn't. Checks the message. She's like, you sent the message to your PCP. Honestly, I was so weak and so delirious. I don't even know what I was doing. Anyway, so She said she would call me back. She was not happy. She called me back. She said the physician that was covering said that when I had and canceled all my antibiotics, canceled all my lab work, canceled everything. He wants me to go to an emergency room and he wants me to go and have a PICC line placed. I was like, excuse me? She's like, do you want to talk to him? Of course I want to talk to him. I got on the phone with him, right? And he's like, I already have a treatment plan for you. The treatment plan is to go to the emergency room, go get admitted and have another PICC line. I said, excuse me, did you read my last discharge orders? My last discharge order says after this PICC line, no more PICC line. He said, well, I'm not comfortable with the way you're getting your medication at home. I said, how? You're not comfortable with peripheral lines? He's like, well, Dapto shouldn't be given with peripheral and we sent you home with a PICC line. I said, that's great. I said, but I'm going to have nursing come 3 times a week. I said, before with my PICC line, I was only having nursing come once a week to come and change it, right? But now I'm going to have them 3 times a week to come and start a PIV on me. He said, well, I'm worried about infection. I said, you're worried about infection with a PIV than a PICC line? You want me to go to the hospital and get a PICC line because you're worried about infection with a PIV? He's like, well, it's being done at home. I said, buddy, listen to me. I had my Dapto and everything through a PIV and a midline at the hospital. I did not get a PICC line until the last day that I left, and they did not infuse anything through it. So I said, have you looked at my history? I've been in the hospital 7 times in 10 months for line infection. I've had 2 septic thrombosis, and you want to tell me that a PICC line is safer than a PIV? I was like, the last time I was in the hospital, I kept getting phlebitis. I kept getting blood clots. I was like, it is not. So I said, listen, please. I cannot go back to the hospital less than a week than I came out. I said, mentally, I'm sorry. This was the most difficult hospitalization for me. I cannot do it. So I'm begging you, please restore my antibiotics and let's have the nurses come and do it. He said no. So I said, do me a favor, document this, that I have a septic thrombus. You canceled all my antibiotics. I told you why I took out my PICC line. I told you I started feeling better after I took out my PICC line, right? And you still think the best course of action is to go to the emergency room and to be admitted. I said, on top of that, go back and read my chart. Whenever I'm admitted, I decompensate very quickly. It makes all my other chronic conditions worse. I get 3 to 4 doses of epinephrine a day. My heart rate goes up to 150. I have to lay flat. I can't even sit down. It's not an environment for me. My nurses wear perfume. They use bleach to clean the hallway. Eventually, by day 7, my body starts shut down and it's an anaphylactic reaction to after the other. The nurses are begging the ICU to take me. The ICU is refusing to take me. So my poor nurse, who has 4 patients, 3 including me, is running back and forth like crazy. I can't go through that again. I said, I don't want to. Like, can you just please listen to me? I know my body. Let me get it at home. Document everything I said. I said, document that you had a risk-benefit conversation with me and this is what you said. Then I said, okay, fine. You're not my treating physician. He's not my treating physician. I've had issues with him before. I said, I'd like an appointment with my treating physician. He flat out said no. I said, excuse me? He said, no. I said, why? He's like, she's booked. She's busy. I said, excuse me, you're not the master of her schedule. I said, I need an appointment with her. And he's like, no, it's okay. I said, we document everything, right? He's like, not everything. I said, yes, we do. You're going to document this. You're going to document that you said no for me to get an appointment with my treating physician. And I'm asking for this because it does not seem that you can wrap your head around my complexity and make decisions based on the individual person. I said, you have to treat me as an individual. My doctors who know me do treat me as an individual. They take everything holistically into account before they put in a treatment. Now, by the way, he didn't talk to me first. Did not even talk to me first. Did not even talk to me to assess the situation. Immediately was like, just go back to the hospital. Let me tell you something. The hospital is not for everybody. We go there to get better, and I get the heck out of there. That's all. I will fight tooth and nail to go before I go to the hospital. So, with that said, that's the position he took. The validation came when I had an appointment with my treating physician, and she said, you know your body. You had an infection. You pulled out the line. That was the right thing to do. Applause. I had my validation. That was after I had like 6 panic attacks. Stayed up for 24 hours from insomnia. But I have my validation.